federal health care reform. And when we talk about federal health care reform, we're really talking about two laws that were passed just 1 week apart. The main law, this Patient Protection and Affordable Care Act, what some people refer to as PPACA or PPACA, and then followed shortly thereafter by this Reconciliation Act, which reconciled differences between what had been passed a week before and and what the Senate bill had been before. So this second bill is called the Healthcare and Educational Affordability Reconciliation Act of 2010, and I'm not sure how to pronounce HCERA. If anyone has any ideas, I'd like to hear them. But because that second act, the Reconciliation Act, changed some provisions of the PPACA Act, and because they're intended to kind of work together anyway, most people are going to, including myself, are going to just kind of refer to them together as federal health care reform and not necessarily pay attention to one act versus the other. Just kind of view them on a combined basis. Now, I want to, as we go through the slides here, though, it might be helpful for you to have handy, either to follow what I'm saying or maybe to ask a question. The first handout, handout A, has 2 pages to it. Both of them are timelines. And because as I go through the slides, I'm going to be addressing some of these issues not on a timeline fashion, but it might be helpful for you to see where some of these things come into play. We'll certainly be referring to when certain things come into play, when they're effective, but we're going to be bouncing around a little bit during the slide part of the presentation. But it's helpful, I think, visually to see the timeline, especially the first page of handout A. I like the first page better than the second page because the second page has just too much stuff on there, a little harder to read. The first one is a little simplified version of a compliance deadline, a quick reference guide there as to what's effective basically now versus 90 days from now versus 6 months from now and so forth, or farther out. So it might be helpful for you to have that kind of handy as we go through some of these slides. And so I'll address some of the initial slides dealing with federal health care reform, and then I'll turn the mic over to Tim, and he'll finish up on healthcare reform, and then we have a few other topics to get to at the very end, dealing with other health and welfare plan matters. But a good chunk of what we're going to be talking about now is going to be healthcare reform. And originally when we put our program together, we weren't going to address federal healthcare reform at all. If you saw our original invitation, we didn't even make mention of it, and that's because why talk about something if it didn't happen or isn't going to happen? And it really, up until the time it actually happened, it really was kind of questionable whether or not Congress could get it passed or not. So, but then after it did pass, and after we'd already put our invitation out, it passed, and obviously we realized we should be talking about it. We can't have an employee benefits update and not talk to a significant degree about federal health care reform. So we sent a follow-up email, which many of you got, and helped increase the numbers of people here in attendance. So we, taking that into account, that maybe a lot of you here are here to hear largely about that subject, we're going to devote quite a bit of attention to it during our program today.